Hello, everyone, and permit me to stand an existing protocol. My name is Undiga Emuekpere, and I am the principal partner of Okamara Law Nigeria, a law firm, a fertility law firm based in Abuja. And today, my presentation is on the determinants of IVF success, the often forgotten legal dimension. By way of introduction, I am an international fertility lawyer by virtue of the fact that I have practice rights in Nigeria, England, and Wales. In Nigeria, I have 24 years post-call experience and 15 in England and Wales. My specializations include international and domestic surrogacy, donor conception, adoption, etc. And it's been my privilege to serve a clientele that includes intending parents from the diaspora, other foreign nationals, fertility clinics, and surrogates. Um, to start, I'd like to start by asking the question, what does a successful IVF cycle look like? A successful IVF cycle includes having a healthy baby, a healthy mother, conforming genetics, properly procured and documented donor gametes, informed consent from all the relevant parties, have properly drafted documentation, including the surrogacy contract and supplementary documentation, and very importantly, the effective acquisition of parental rights by the intending parents in all countries concerned. Now, before I go on into saying the different stakeholders who are involved in bringing about a successful IVF, I'd like to make a little distinction. There are some IVF cycles where the intending mother carries the pregnancy herself. In other IVF cycles, there might be the use of donor gametes. It might be donor egg or donor sperm. So in a very straightforward cases, you would have a situation where the intending parents use their own eggs and sperm, in which case they're using own egg and own sperm, and then the intending mother is carrying the pregnancy. That's the most straightforward scenario. But in other scenarios, you might have the involvement of a donor egg or a donor sperm or a surrogate. So who are the people involved in a typical IVF? In a successful IVF cycle, we have the intended parents, we have the fertility treatment providers, we have the surrogacy management agencies, gamete donors, surrogates. And for the purposes of my discussion, I'll be focusing on the legal advisors and the legal systems of the treatment and residence countries, which is always something that's happening in the background that people are not really very conscious and aware of, as evidenced by the interaction between the intending parents and the High Commission of embassies whenever there's an international element involved in an IVF treatment cycle. So, what are the roles of the different stakeholders in bringing about a successful IVF cycle or a successful fertility treatment cycle? So if I were to describe the role or the most important thing that intending parents need to do in an IVF cycle is to do due diligence. They need to do the research to find out what the laws and the requirements that apply in the fertility treatment country or the fertility treatment country and their residence country if they came from a different country to have their fertility treatment, the legal implications of the fertility treatment plan. More often than not, the fertility doctors have a very narrow clinical focus. They're all interested in bringing about a pregnancy. They're not really bothered about the legal implications of what they're doing. And that is the job of the intending parents to go and do their homework to find out about the legal implications of the fertility treatment plan, and particularly if it involves gamete donation and surrogacy. I always say that the intending parents need to advocate for themselves from the beginning to the end. The hospital's lawyer, the agency's lawyer, if there's a surrogacy agency involved, that lawyer that was recruited by the hospital or the agency is not your lawyer, especially if there's an international element involved. You need to get a lawyer who is very conversant and knowledgeable about the requirements of the intending parents, especially as regards removing the children from the treatment country and taking them to the destination country. Very important. When do you need to get your legal advisory services? Ideally, you should get your legal advisory services before you start. And even after getting your legal advice at the beginning, if things change, as they very often do, you should go back and verify and confirm the position legally from your legal advisor. The changes involved that might be envisaged might be, you might have envisaged that you're going to carry the pregnancy yourself, that you use your own sperm, you use your own egg. But after the treatment has started, the fertility treatment provider might recommend that you use a surrogate, or that you might use a donor egg and a donor sperm. If those kind of changes occur, it's very important to go back to your legal advisor and verify the position before you continue. We're getting a lot of cases where there's a lack of full disclosure between the parties, between the spouses, the intending parents wanting to hide the fact that they used donor egg or donor sperm, or hide the fact that they were directly involved in the recruitment of an egg donor or a sperm donor who is connected to them in one way or the other. These are things that the intending parents also need to look out for. What are the role of the fertility clinics? The obvious things: quality patient care and fertility treatment, counseling and informed consent, ethical practice in terms of gamete sourcing, full disclosure to the patients, adherence to AFRH guidelines and other laws, proper documentation and record keeping. There always seem to be problems with the clinics regarding the documentation and getting informed consent regarding revisions to treatment plans. And I'd like to make a little note and emphasize about embryology and the fact and the importance of conforming genetics. At the end of the process of the IVF cycle, the intending parents should be able to run a DNA test and find out that the child, the surrogate born child, or the donor conceived child, or the child that was born by the intending mother, has the genetics, the genetic origin that was envisaged under the treatment contract. So if it was envisaged that it would be the intending mother's egg, the intending father's sperm, that should be verified by a DNA test, and it should be conforming with what they had agreed would happen at the very beginning. The same thing happens if there was donor egg or donor sperm involved. These are very important points. What is the role of the surrogacy management agency? Critically, the vetting, proper surrogacy recruitment, the vetting and the pastoral care of surrogates, the provision of anonymity, if that is what is required by the intending parents, counseling and informed consent, the keeping of proper documentation and records, and the protection of the interests of the intending parties and fairness to the surrogates. Gamete donors, the very little I can say that has already been said before, but I'd like to emphasize on the disclosure of medical history and other relevant information, and also the awareness of the implications of that gamete donation in cases where there is a known donation. In cases, for instance, where a friend donates the egg or the sperm, or a sister donates the egg or the sperm, or somebody who is otherwise known to the intending parents, the parties should be aware that the fact of that gamete donation might change the dynamic of the relationship between the different parties involved. Same thing, what's the role of successful surrogates? I'd like to emphasize particularly on contractual compliance. There are some very important clauses in the surrogacy contract that the surrogate must comply with. She should get herself duly informed, provide informed consent. If at all possible, get a lawyer to make sure that you get a lawyer that is loyal to you, to walk you through that agreement and make sure that you completely understand it before you sign it. Surrogates should keep proper documentation and records of all payments and all interactions, very important. And there should be a very high level of awareness of the implication of the surrogacy in terms of future implications on their health and their future plans. And then I like to focus now on the importance of legal advisory services. Now, it's not very obvious to a lot of people why legal advisory services or a lawyer's advice is important in IVF or other fertility treatments. If I were to summarize the role or the function of getting legal advice, would be to ensure that the intending parents can acquire full parental rights over a donor conceived or a surrogate born child with the envisaged genetic composition, and have the ability to take that child home with them with as little delay as possible. That would be a summary of the objectives of legal advisory services in IVF and any other context of assisted reproduction. And how, in order to achieve that, the focus is very firmly on the collation and drafting of a full dossier, a full collection of documents that are required by the treatment and or the destination countries. So, To break that down a bit, what is really involved in legal advisory services in regard of IVF or any other assisted reproduction procedure or process? So it's to enable the intending parents acquire parental rights over those children in all the countries concerned, in the treatment country, in the destination country, or the residence country, to make sure that proper documentation is collated and drafted, which includes surrogacy agreements, gamete donation certificates, screening certificates, and so on and so forth. The legal advisor in an IVF cycle or a fertility treatment cycle is very focused on making sure that there is compliance with the terms of all the contracts that are involved, and there are a number of them. This include the gamete donation contracts, or the gamete donation and gamete sourcing contracts, the fertility treatment contracts, the surrogacy agreement, and if there's a surrogacy management agency involved, that surrogacy management contract, the legal advisor will be looking at all those contracts and making sure that everything is done as is expected to be done to avoid problems in the future. The legal advisor will be advising the intending parents or whoever in order to avoid pitfalls and scams, which are plentiful in Nigeria. Unfortunately, people seem to want to take advantage of the desperation of intending parents who are facing infertility. In cases where there's gamete donation, there's usually, is more often than not, there's some vulnerability. The intending parent who is not contributing genetic material. So say, for instance, if the treatment plan involves a donor egg, it means that the intending mother is not providing the egg, and so she's not a genetic, she will become a non-genetic parent. Usually in those kind of positions, the non-genetic parent tends to be in a vulnerable position, and a legal advisor will make sure that the interest of that non-genetic parent are protected. We also will be looking at to make sure that informed consent is gotten and properly documented, and that there is contractual compliance by all the parties concerned. So this will be involved the surrogacy management agent, the fertility clinic, and any other parties who are involved in the IVF or treatment cycle. Now, I'd like to say a few things about international surrogacy. I'm seeing a lot of intending parents coming from abroad who land in Nigeria and have already started their treatment before they think about getting legal advice. So these issues, these are questions that intending parents who are coming from the diaspora or who are traveling, leaving the country of their residence to a different country for their fertility treatment. These are questions that you need answers to before you leave, before you start your treatment. Very important. These questions include the fact that is surrogacy legal in your destination country? Is surrogacy legal in the country where you intend to take the surrogate born children to? Is donor conception recognized? Is double gamete donation going to be a problem? Double gamete donation is where the IVF or treatment cycle or the surrogacy is done using an embryo that was conceived, that was created using a donor egg and a donor sperm, in which case none of the intending parents will have a genetic connection to the child. You need to find out how you acquire parental rights, both in the country where you intend to live with these children and the country where the treatment is going to be done, in this case, Nigeria, for Nigeria. You need to find out what you need to do and when. They're usually very strict and procedures and processes and timelines within which you need to do certain things. You need to find out what those timelines are, when the deadlines are, and whether or not those deadlines are flexible or not, and what you need to do. And then very importantly, what documentation is required. Now, answering the answers to all these questions are things that your legal advisor, a competent fertility lawyer, will be able to provide you. So in conclusion, I would say that assisted reproduction, IVF, surrogacy, and donor conception can be tricky, I must admit, but with the right guidance, it is completely possible to achieve positive outcomes, and many people are happy parents after having gone through all these processes. But I must emphasize that competent legal advice is critical. The best time to get legal advice is at the beginning of the treatment and not in the middle or at the end, as some people tend to do. It's very important to, if you get legal advice at the beginning, it's very important to go back to your legal advisor and notify them if there are changes in the fertility treatment plan. If, for instance, you decide to use a surrogate, go back and ask what the legal implications of that will be. If you decide to use donor egg or donor sperm, same thing applies. And I'd like to end by thanking you for listening. And these are my socials. I'm known online, not as Undiga, but as the Niger fertility lawyer. And I look forward to your questions, observations, and other remarks. Thank you.